Hello, good day. My name is Naja Savera. I'm a leading epidemiologist in the Bahamas, and I will be presenting tuberculosis, its history, modes of transportation, and also its signs and symptoms as well as treatment. Hello, good. What is TB? TB is a bacterial infection that is most commonly affected in the lungs. TB is caused by the bacterium Mycobacterium tuberculosis. The organism is a fast acid aerobic bacillus with a high cell wall content of high molecular weight lipids. When a person breathes in TB, the bacteria can settle in the lungs and begin to grow. From there, they can move through the body and to other parts. Modes of transmission. Human beings acquire the infection with one of the following routes: inhalation, ingestion, or sometimes rarely transplacental. Risk and causes of TB. Close contact with individuals who are infected. Not being vaccinated is a number one. Using drugs is also a way that you can become infected, and also working in the medical field. Persons who are at risk of TB. Children are a high factor at being at risk of TB. Immunocompromised individuals, along with people who have HIV and cancer. Malnutrition and also the elderly are at high risk of getting TB. Tuberculosis is transported from human to human and spreads mainly airborne. When a person with pulmonary TB coughs, the bacteria is expelled and they remain floating in the air. Once a person has inhaled these droplets of TB, the bacteria enters the lungs, which can become infected. When inhaled, the TB travels down to the trachea and enters the lungs. Once in the lungs, they collect in the alveolar sac, and the bacteria begins to multiply. The body's immune system will work to surround the bacteria, and a granuloma is formed to keep the bacteria from spreading. Within a period of 8 to 10 weeks, the person will likely test positive for latent TB, and in this phase of latent TB, they do not feel any symptoms. But once the granuloma breaks, the bacteria starts to multiply again and begin to destroy the person's lungs, which is called pulmonary TB. There are 3 stages of tuberculosis: primary, latent TB, and active TB. Primary TB is the first stage of tuberculosis infection. The immune system tries to fight off the bacteria, but sometimes it doesn't destroy all. In this time, they begin to multiply. Persons may experience at this time no symptoms or maybe flu-like symptoms. Latent TB. Latent TB, the bacteria is present in the body, but the immune system is keeping it at bay. There are no present symptoms at this time and is not contagious during this period either. Active TB now. The bacteria is multiplying at this stage, and this is where the person becomes infected, and at this stage the bacteria will spread. Clinical manifestation of tuberculosis. Tuberculosis often carries common-like symptoms. There is coughing lasting up to 3 to plus weeks, coughing up blood sometimes, chest pains, no appetite, weight loss, fevers and chills, night sweats, and weakness and fatigue. Preventative strategies used to prevent the spread of tuberculosis. Good ventilation. Good ventilation helps to prevent the transmission of TB in an indoor setting. Respiratory hygiene. Covering your mouth and nose when you sneeze is very important to reduce the risk of spreading TB to people around you. Vaccination, one of the most important ones, would be to help prevent from birth and during adult years the spread of TB. Also, preventative measures like medication are also great as well.